To former FDA Commissioner Dr. Scott Gottlieb. Thank you for talking with us this morning. Let's jump right in here. I'm listening to Melanie's case. She's young. Frankly, it's kind of scary. I mean, we heard her story. We're wondering how common it is to have symptoms for so long. And in her case, and for so many like her who are young like that, does that mean they remain contagious?
Well, she's probably not contagious, but we do see with viruses, sometimes people develop a post-viral syndrome. We don't know that that's what's happening here with COVID. But with other viruses, when you have an epidemic of a virus, Epstein-Barr disease, echovirus, you do see some residual effects on certain people that seem to be mediated by the nervous system, where people have this post-viral syndrome that can be associated with fatigue. And we know that COVID in particular seems to affect the nervous system. The loss of taste and the loss of smell in some patients is suggestive that the virus is having some effect on the nervous system.
Well, yesterday, the FDA withdrew its emergency approval for 2 anti-malaria drugs used to treat COVID-19. Why has the FDA reversed advice on these drugs?
There have been a number of studies that had come out looking specifically at hydroxychloroquine that didn't show that the drug was having a benefit. And that was set against the backdrop where we were learning more about the side effects of the drug in the setting of COVID. We've long known that that drug has certain side effects. But in the setting of sick patients who have coronavirus, who are hospitalized, who are critically ill, those side effects seem to be more manifest. And so in a setting where we didn't have evidence that the drug was providing a treatment effect but was causing side effects, that's what probably prompted the FDA to withdraw that emergency use authorization. There was also data that came out yesterday showing that the drug could interfere with the activity potentially of remdesivir, an antiviral drug that's now authorized for the treatment of coronavirus. It's the only drug that's specifically authorized for the treatment of coronavirus. And so if hydroxychloroquine, a drug that probably isn't delivering any benefit, interferes with the activity of a drug that we know is delivering a benefit, that's not favorable. And so that's probably why the FDA pulled it. There's some studies underway looking specifically at hydroxychloroquine, some more rigorous studies. Some data came out from one of those studies today in association with another drug, a steroid used in the setting of critically ill COVID patients. I suspect FDA might have gotten a look at the hydroxychloroquine data coming out of those studies. Even though they haven't been released yet, FDA might have gotten some indication of where that data was trending as well.
Are we in a second wave? I only have 20 seconds left, but I think that's the big question. People are wondering, as everybody is reopening now, should we be worried for another wave?
I think we should be worried for the fall, the second wave in the fall. Right now, we're seeing outbreaks in certain states, Texas, Arizona, Alabama, Florida, certain cities, Houston and Austin in Texas. They need to get that under control. Those outbreaks can get out of hand.
All right. Dr. Scott Gottlieb, thank you so much for your time. I'm sure I'll be talking with you again soon.